Hi everyone, it's Dr. Bishop here. In this video, we're going to discuss the anatomy of a research article. Some of you may have already read a lot of research articles, but if you are like me when I started medical school, then you may not have the experience reading a research article. And as you know, we are embarking on an evidence-based medicine curriculum where we will not only expect you to read research articles, but we will expect you to be experts in reading research articles. Personally, I didn't know the anatomy of a research article until I started writing them. And personally, I don't want you to have to wait that long to learn this stuff. Let's start by finding a research article. You've started learning about information sources and databases to find articles. But one journal I regularly read, and a great place to start, is the New England Journal of Medicine. Here's the New England Journal of Medicine website. It's one of the preeminent journals in the US and one of the most read. It's a great place to read cutting-edge research as well as opinion articles and reviews. You can get weekly alerts with online articles and tables of contents each week. Let's see what's happening in the journal this week, or at least the week I'm recording this video. So if we scroll down through what's happening, we can find this week's table of contents. And in the original research area, you can see some interesting research articles. Here's one that looks interesting. Ivabradine in stable coronary artery disease without clinical heart failure. I've actually downloaded the PDF of the article because that is how it will look in a journal. When you first look at an article, it can be really overwhelming, and there will certainly be terms and descriptions that you won't be familiar with. But I want to emphasize one key point. Every research article follows a standard format. There are 6 parts to every research article. There is an abstract, an introduction, the methods, the results, a discussion section, and the references. There are also tables and figures which usually show results, but can also show some of the methods. Let's go through each of these sections in the New England Journal article. Let's start with the abstract. The abstract is a summary of the article and is usually about 250 to 500 words. Journals format their abstracts differently, but as you can see, the abstract in this article generally follows the format of the full article. It shows a snippet of the background, the methods, the results, and the conclusions. The introduction section is the next section. In the introduction section, researchers will often make a case for doing this study. They will outline the problem, describe the current knowledge and what is the gap in the knowledge, and describe the purpose of the study. If we continue after the introduction, we get to the methods section. This is usually the most daunting section to read. But again, if you are going to be experts in reading an article, then you need to know at least how to navigate this section. The methods section does differ by the type of study that's being done. Later during the EBM course, you will learn specific items to look for in the methods section for different types of articles. In this article, the first subsection describes the type of study or study design. The next subsection describes the participants or the study subjects. They then go over the interventions that were done in the study. So what did they do to these subjects or with these subjects? And then they go over the endpoints or the outcomes that they wanted to look at. The last section of almost every methods section is a statistical analysis section. This is where the researchers discuss many of the types of analyses that you learned in the biostatistics module. It's worth reading a few statistical sections to test yourself and see if you understand the terminology and the concepts. If we continue on, we move over to the results section, and as you might guess, this is where the authors report the results. Most articles report results in tables and figures, and in general, describe those tables and figures as text in the results section. Sometimes there are items in the text that are not in the figures, so you have to read the results and review the tables and figures. Almost every article has a Table 1 that shows the characteristics of the population or the sample in the study. The other figures and tables show different things. For example, this table is showing the primary endpoints in different groups of the study. And this figure is showing the primary endpoints in a different way, using a time graphic. The final section of every research article is a discussion section. In this section, the authors pull everything together. The first paragraph of a discussion usually summarizes the results. The rest of the discussion may describe whether the results were expected, how they compared to other studies, and the implications of the findings. Every discussion section has a limitations section, where the authors discuss the limitations of the study. It's worth reading a few limitations sections to understand the weaknesses and strengths of different types of studies. Last but not least is the bibliography, with all of the references. This may not be the most exciting section, but it's a great place to look if you want more background on the material or want to explore the topic further. And that's it. Now you are an expert in the anatomy of a research article.